disease, and I talk about viral hepatitis. Viral hepatitis is caused by 5 types of viruses, which is herpes virus type A, B, C, and D. E virus also is a rare cause for hepatitis. Hepatitis A هو most common type, and it is the most benign form of hepatitis. It is caused by RNA virus. Transmission to the human, it is almost always from person to person. يعني ما ينقل from animal to the human. By contact through the fecal-oral route, and infection has been associated with contact with contaminated food or water or after travel to the endemic area. فينقل عن طريق الفود إذا كان contaminated أو عن طريق الwater. Also, contact with infected person or in the child care center, يعني الحضانات للأطفال. In the household contact. Hepatitis A virus is secreted in the stool from 2 weeks before to the 7th day after onset of jaundice. يعني قبل لا يبدي عندنا الساين والسيمتوم before onset of jaundice 2 weeks يبدي الفيروس secreted in the stool. وهنا طبعا ممكن أيضا ينقل الانفكشن to another one. وcontinue for 1 week after onset of the jaundice. هذه هي البيريود اللي هي contagious period to transmit the infection for another. Clinical manifestation for hepatitis A in incubation period about 3 weeks, and after that systemic symptom will appear. At first تكون non-specific symptoms: fever, malaise, nausea and vomiting, anorexia, abdominal discomfort, also diarrhea can occur in children. After that the jaundice will appear. يعني تبدي عندنا systematic symptoms, then the jaundice will appear with dark color urine and pale color stool. طبعا الستول تكون pale stool أو alcoholic stool due to defect in the hepatocyte، المشكلة بالليفر نفسه، فيقلل secretion of أو excretion of conjugated bilirubin. Also there is right upper quadrant pain اللي هو at the site of the liver. There is pain and tenderness. As we say, this is the jaundice in the sclera. Jaundice أول site يبدي بي عندنا in the body هو in the sclera, and then this appear in the skin and in the other mucous membrane. And this is the dark color urine of jaundice due to contain bile pigment. Typical duration for the illness about 1 to 2 weeks. Sometime and rarely there is other organ will affected in the hepatitis A, like lymphadenopathy and splenomegaly, aplastic anemia. Fulminant hepatitis, it is uncommon in children, but co-infection with hepatitis C increase risk for fulminant hepatitis. Fulminant hepatitis نقصد يدخل المريض بالacute hepatic failure. Hepatitis A not associated with chronic liver disease or intestinal carrier state. احنا عندنا بقية الفيروس هسه راح نذكرها hepatitis B and C ممكن تسبب chronic hepatitis أو carrier state. Hepatitis A not associated with chronic disease or a carrier state. It is only cause acute infection. For diagnosis of hepatitis A, in addition to the sign and symptom in the examination, we can do serological tests to detect the antibodies to hepatitis A virus, which is anti-hepatitis A, IgM and IgG antibody in the serum by radioimmunoassays. As we see in this picture, fecal excretion of the virus starts during incubation period before appearance of the symptom, and this is continue to shedding in the first 7 to 14 days. هذا البيريد of infectivity. The first appear anti-hepatitis A virus IgM antibodies. This is last for a few months. After that, it will disappear and replaced by anti-hepatitis A virus IgG antibody, and this is remain for many years. Identification of viral particle in the stool, and also we can do polymerase chain reaction to detect the RNA of the virus. We can also do liver function test. There is an increased TSB, hyperbilirubinemia, which is either mixed or mainly conjugated direct bilirubin. Also raised in the serum level of enzyme, which is alanine aminotransferase and aspartate aminotransferase with alkaline phosphatase. We have some complication for hepatitis A. As we say, it is the most common benign type, but sometimes there's rare complication. Most patients achieve fully recovery. Acute liver failure, which is fulminant hepatitis, it is rare, as we say, but can occur. And those at risk for this complication was adults, those who have underlying liver disorder from the first, or immune compromised children. Those more liable to develop acute hepatic failure. Also, edema and ascites can occur. This is due to low albumin level, which is due to decreased synthetic activity of the liver. The treatment for hepatitis A, we have no specific treatment for this viral infection, and the treatment only symptomatic and supportive treatment. We can give IV hydration if I need. Hospitalization indicated only in some cases. We treated the patient in home, not need admission, and admit to hospital only if there is repeated vomiting and dehydration, need IV fluid, or when there is prolonged prothrombin time, which is mean there is a degree of liver injury. In these two cases, we can admit the patient to hospital. Otherwise, treated at home with only supportive treatment. The prevention for hepatitis A, first, the patient should be excluded from school, from child care, or from work during contagious period. يعني ياخذ المريض sick leave اللي هي الإجازة المرضية خلال الفترة. احنا قلنا after jaundice, after appearance of jaundice يبقى for 1 week. في تقريبا 1 week after appearance of symptom الإجازة to prevent spread of infection to another. Also, we need careful hand washing, particularly after changing the diaper and before preparing the food. The third line of prevention is the vaccine, and we have 2 inactivated hepatitis A vaccine, which is approved for children more than 2 years of age, and will administered IM in 2 doses. The first dose, second dose about 6 to 12 months after the first dose. This vaccine can be taken at any time in children or more than 2 years and in adults. The other type of hepatitis, it is hepatitis B infection, and this is caused by hepatitis B virus, which is DNA virus. The surface of this virus contain particles designated hepatitis B surface antigen, which is called hepatitis B surface antigen. هذا طبعا مهم الانتيجين بالdiagnosis راح نحكي عنه. The inner portion of the viron contain hepatitis B core antigen, which is called hepatitis B core antigen, and the nucleocapsid that encoded the viral DNA called hepatitis B E antigen. This is served as a marker of active viral replication. هذه الانتيجينز ال3 antigens مهمة بالdiagnosis لأن تعتبر important serological markers. Hepatitis E antigen, hepatitis B E antigen, this is indicate active viral replication, if you found. Transmission of hepatitis B occur through blood and blood product exposure, يعني عن طريق البلد مثلا blood product البليتلت البلازما، الكرايوبريسيبيتيت اللي ممكن اكو بعض الديزيز نحتاج انه ننقل لهم بلد برودكت اذا كان contain the virus so you can transmit to the patient. Also through sexual contact, through IV drug addict, by tattoos. هذه التاتو اذا كانت contaminated النيدل ممكن تنقل لك الفيروس. Intimate contact with the carrier. الكارير ايضا ممكن يكون asymptomatic بس ينقل الديزيز for another one. Also transplacental transmission from infected mother which is contain hepatitis B surface antigen, and the risk of transmission is greatest if the mother also hepatitis B E antigen positive. لان احنا قلنا hepatitis B E antigen indicate active infection, active replication of virus. فإذا اثنين موجودات السيرفيس انتيجين والإي انتيجين يكون ال risk for transmission from the mother to the fetus during pregnancy is greatest. Transmission also can occur at the time of delivery from infected mother, from amniotic fluid, from maternal feces, or from blood that contain the virus. Hepatitis B surface antigen is recovered in breast milk of affected mother. يعني ممكن إذا الأماية هي already infected by hepatitis B فالsurface antigen also found secreted in the milk, in the breast milk. Clinical manifestation for hepatitis B تشبه تقريبا يعني like hepatitis A بس ممكن another symptoms and more severe. Incubation period is long duration period, about 45 to 160 days. After this incubation period, the first clinical evidence will appear is elevation of liver enzyme, which is ALT enzyme. There are also lethargy, anorexia, and malaise. Jaundice usually began 8 weeks after exposure and lasting for about 4 weeks. The illness may be preceded by arthralgia or skin lesion like urticaria or papular acrodermatitis. ممكن إنه appear before appearance of jaundice. Extrahepatic condition can occur in hepatitis B like polyarteritis, glomerulonephritis, and aplastic anemia. Chronic carrier state, it is defined as positive for hepatitis B surface antigen for more than 6 months. And this is complicated about 10% of cases in children. يعني إذا بقى عند الطفل هو بالacute infection من نسوي له serological marker راح نلقى عنده hepatitis B surface antigen. إذا بقى more than 6 months positive hepatitis B surface antigen in the blood هذا نعتبره chronic carrier state, chronic carrier hepatitis B. On physical examination, when examine the child with hepatitis B, there is ecteric skin jaundice with yellowish discoloration of mucous membrane. There is hepatomegaly and tender liver, splenomegaly and lymphadenopathy. There is also clinical sometime when there is sign of altered sensorium and hyperreflexivity. This is indicate encephalopathy and acute liver failure. يعني احنا اذا شفنا الطفل هو hepatitis B infection stable الطفل بس من يصير عنده اي changes مثلا altered sensorium الconscious level بدأت تصير عنده hyperreflexivity اللي هي sign of upper motor neuron معناها الطفل دخل مرحلة الانسيفالوباثي والacute liver failure. For diagnosis of hepatitis B, as we say, the main diagnostic method is the assessment or detection of serological markers. The serological markers اللي ذكرناها أن the first one هو hepatitis B surface antigen. This is the first serologic marker of infection to appear in the blood. Other serological marker we detected antibody to the hepatitis B core antigen اللي ممكن تكون ال first appear هي ال anti-hepatitis B core IgM antibody, then later on replaced by anti-hepatitis B core IgG antibodies. Anti-hepatitis B surface antibodies أيضا تكون موجودة. Anti-hepatitis B surface antibody and anti-hepatitis B core antibody detected in patient with resolved infection. يعني إذا طفل أو مريض قبل فترة صار عنده infection with hepatitis B but it cover يعني complete recovery and resolved infection. من تيجي تسوي له serological marker راح نلقى عنده anti hepatitis B surface antibodies and anti hepatitis B core antibodies. This is mean previous resolved infection. If the patient take immunization يعني patient ماخذ hepatitis B vaccine قبل فترة السيرولوجيكال ماركر اللي راح نلقاها موجودة بالبلازما هي anti hepatitis B surface antibodies only. إذا عنده previous infection تلقى الهيباتيتس B surface antibodies والانتي hepatitis B core antibodies. إذا لا ماخذ لقاح سابقا تلقى فقط الانتي hepatitis B surface antibodies. Also, we can detect it another serological marker هو hepatitis B E antigen, and as we said, this is mean there's active infection. سواء كان acute or chronic. إذا كان positive E antigen معناها active viral replication والrisk of transmission يكون greatest. We can detect it the DNA of the virus and the serum, and also we can do liver function test. Liver function test, we found there is hyperbilirubinemia, which is mainly, it is either mixed or mainly conjugated bilirubin. Also, there is elevated liver enzyme, AST, ALT, and alkaline phosphatase. As we say here, the first serologic marker which is appear is hepatitis B surface antigen. After that, hepatitis B anti-hepatitis B core antibody will appear اللي هي IgM and then replaced by IgG. Also, there is anti-hepatitis B surface antibodies will appear in the plasma. Complication for hepatitis B, the first one is acute liver failure. And this is occur more frequently with hepatitis B than other viruses. احنا قلنا hepatitis A ممكن يسبب acute hepatic failure but rarely. While the most common virus اللي يسبب acute liver failure هو hepatitis B infection. Also, it can cause chronic hepatitis if remain positive surface antigen more than 6 months, and this is later on lead to cirrhosis and stage liver disease ممكن primary hepatocellular carcinoma. Membranous glomerulonephritis, this is also complication for hepatitis B. It is occurred due to circulating immune complex. For treatment of hepatitis B, in case of acute infection, it is also supportive treatments as in hepatitis A. احنا من نقول supportive treatment نقصد به انه احنا بما انه المشكله اصلا هي بالليفر فنحاول انه نعطي للبيشنت simple يعني دايت not heavy meal simple sugar بحيث انت تريح مثل ما نقول احنا نريح الليفر لان هو الليفر هو المين اورجان اللي يسبب لنا ميتابوليزم لكل الاورجان او السبستانس ان ذا بودي. فانت حاول دائما انه ما تنطي فد هيفي ميل خصوصا الفات تقلل الفات ننطي سمبل شوجر نزيد للانتيك الهايدريشن يعني الاورال فلويد انتيك نتجنب ننطي له حتى لو كان عنده فيبر اذا تضطر انه تحاول انه ما تنطي دوز عاليه من الانتي بايرتيك اللي هو الباراسيتامول او الاسيتامينوفين نحاول نعطي اقل جرعه اذا يحتاجها الطفل. إذا لا هو كان عنده الطفل repeated vomiting ممكن dehydrated ما يقدر ياخذ orally, now we can admit him to the hospital, give him IV fluid and supportive other treatment. In case of chronic hepatitis B, this is treated with a drug called interferon alpha, and lamivudine also can be used in chronic hepatitis B in children older than age 2 years. For prevention of hepatitis B, first by vaccine, hepatitis B vaccine. Infant born to hepatitis B surface antigen positive mother would receive vaccine at birth with hepatitis B immunoglobulin as soon as possible within 12 hours. يعني إذا كانت الأماية عندها hepatitis B infection. فمعناها الهيباتيتس بي سيرفيس انتيجين بوزيتيف. At birth الطفل أول ما ينولد neonates we should do to him investigation، يعني ندزه hepatitis B surface antigen. إذا طلع عنده hepatitis B surface antigen positive معناها الطفل مصاب، فبعد خلص هو مصاب الطفل ما تنطي شيء. بس إذا كان الطفل ما مصاب يعني طلع الهيباتيتس B surface antigen negative، إذا الطفل not infected، إذا هنا راح لازم أنطي للطفل أنطيه hepatitis B immunoglobulin وأنطيه hepatitis B vaccine after delivery within 12 hours after delivery as soon as possible to protect him from get infection from the mother. Post-exposure prophylaxis, we can give hepatitis B vaccine and immunoglobulin for household contact, sexual, needle sharing contact, those with blood exposure and immune compromised patients. The other and last type of hepatitis is hepatitis C. And this is previously known as transfusion-related non-A, non-B virus. لأنه المين روت أو المين method for transmission of hepatitis C هو عن طريق البلد transfusion أو blood product، فسابقا كانوا يسموه حسب يعني transfusion-related non-A, non-B hepatitis. It is caused by RNA virus. And the most common cause, it is the most common cause of chronic liver disease in adults. أكثر فيروس من اللي ذكرناهم يسبب chronic liver disease هو hepatitis C. Risk for a transmission of this virus first blood transfusion, blood or blood product as we say. Illegal drug use or exposure to blood or blood product from hepatitis C virus infected individual. Sexual transmission. Occupational exposure. Occupational exposure نقصد بالسب ستاف والستاف اللي يشتغلون بالمستشفيات، يعني خصوصا اللي يداومون بالمختبرات، لأن يكونون in contact with the blood from infected patient. فممكن إنه commonly get infection by needle، يعني needle or عن طريق البلد ممكن إنه هو get infection. Perinatal transmission from mother to her infant أيضا during pregnancy ممكن ينقل إلى الإمبريو أو الفيتاس يسبب لنا infection or after delivery if the mother is infected. Clinical manifestation after an incubation period that is about 7 to 9 weeks. Start the sign and symptom. Acute liver failure, it is rarely occur. Hepatitis C, it is the most likely virus to cause chronic infection. طبعا الكرونيك انفكشن بالهيباتيتس سي ممكن تكون asymptomatic، يعني اغلبهم يكون there is no sign and symptom and discover accidentally. ممكن رايح يتبرع دم الشخص اخر او هو مسوي فد روتين انفستيجيشن واكسيدنتالي ديسكفر انه هو chronic carrier with hepatitis C، لانه اغلب الكيسات تكون asymptomatic there is no sign and symptom. فيفضل دائما اللي يعني protect himself if you working in the lab or in the hospital. Chronic hepatitis C virus infection, this is defined by persistent elevation of ALT in the presence of hepatic fibrosis and by presence of hepatitis C virus RNA in the blood for more than 6 months. هذا نعتبره chronic infection. For diagnosis, we can do serological tests to detect the antibodies. The hepatitis C antigen, which is anti-hepatitis C virus antibodies. And PCR also we can do to detect a small amount of hepatitis C virus RNA. In this picture, we see the complication of hepatitis C, chronic hepatitis C infection. This is the healthy liver it may lead to fatty liver and end stage by cirrhosis. This is after many years. سواء chronic hepatitis B or hepatitis C. We can do liver function test as other viral infection. There is an increase in the TSB, an increased liver enzyme. We can do liver biopsy to assess the present and extent of hepatic fibrosis. Complication of hepatitis C, as we said, is the most common virus to cause chronic hepatitis in about 60 to 80% of cases. And this chronic hepatitis later on complicated by cirrhosis or hepatocellular carcinoma after many years. And rarely it can cause acute liver failure. For treatment of hepatitis C chronic infection, we can use interferon alpha and ribavirin. This is for children more than 3 years of age. For prevention of hepatitis C, there is no vaccine available to prevent hepatitis C virus. ما عندنا أي فاكسين للهيباتيتس سي، موجود فاكسين هيباتيتس A، هيباتيتس B، وممكن يعني ياخذ الشخص بأي وقت. بالchildren أكثر من 2 أو بالadult at any time. Hepatitis C, there is no vaccine available, so we should protect ourselves from get infection by contact with any infected person or any blood products. Thank you. Any question طلاب على المحاضرة؟